Welcome to this channel. Myself Dr. T. the Doctor of Modern Medical Science, Motivational Speaker and Life Coach. आज इस वीडियो में हम लोग बात करेंगे अल्कोहल विथड्रॉल ट्रीटमेंट। अगर आपके आसपास में कोई आदमी दारू बहुत पीते हैं और अचानक दारू पीना छोड़ दिए हैं तो उनको जो प्रॉब्लम होगा, क्या क्या प्रॉब्लम होगा और इसका इलाज कैसे होता है, इसके बारे में इस वीडियो में हम बात करेंगे। अगर आप खुद दारू पीते हैं या फिर आपके आसपास कोई दारू पीने वाला आदमी है तो डेफिनेटली इस वीडियो को शेयर जरूर कीजिए। शुरू करते हैं अल्कोहल। हम लोग बोलते हैं ADS, दैट इज अल्कोहल डिपेंडेंस सिंड्रोम। नाउ अल्कोहल डिपेंडेंस सिंड्रोम मतलब he or she should be independent to that substance. Okay, now how we will decide whether patient is dependent or not? For that we need some criteria, like I remember like that CCT and HSW. CCT, HSW, these are the 6 criteria for to say that patient is dependent for the substance, mostly for alcohol or any other substance. That is craving. C for craving. The person should have craving for that substance, right? Number 2 is the loss of control, or we can say control loss. Okay, loss of control. And T is tolerance. Tolerance means he need much more amount of alcohol to get the same effect. Okay, पहले 2 पैक लेते थे तो उनको मस्त लगता था, लेकिन आजकल 2 पैक से कुछ नहीं हो रहा है, इसको 4 पैक या 6 पैक लेना पड़ रहा है. Then we call it as a tolerance. Okay, and H means harmful use. He or she knows that using alcohol actually damaging him. लिवर डैमेज हो जाता है, बहुत सारे डैमेज हो जाता है, खाना पीना नहीं होता है, तो he knows that the drinking alcohol actually causing some harm. Till then he will continue drinking. That is called harmful effect. Harmful effect is the salience. Salience means priority in life. Priority in life, like drinking alcohol is not the first priority. First priority is having the food, right? लेकिन जो लोग दारू बहुत पीते हैं, आप देखे होंगे खाने का सामान बेच के भी दारू पीने के लिए पैसा ले लेते हैं. दैट इज कॉल्ड सेलियंस. मीन्स इसका जो टारगेट है, जो लाइफ का जो मकसद है, वो चेंज हो जाता है. जीने का जो लक्ष्य होना चाहिए वो चेंज हो जाता है. एंड लास्टली विथड्रॉल सिम्टम्स. Withdrawal symptoms. These are the important criteria to call the patient is alcohol dependence or not. If it is more than or equal to 3 symptoms, persist for more than or equal to 1 month, we can call that person is dependent for this substance. Okay, is dependent for this substance. That is called alcohol dependence syndrome. ADS means alcohol dependence syndrome. Alcohol dependence syndrome. Now, once the patient is dependent to the substance, he will take anyhow, he will take the substance. Now, if you are not allowing him to take the substance, means to drink alcohol, if you are not allowing, the patient is ADS, he needs alcohol to survive, but you are not allowing him, you are not allowing him to drink alcohol, that means he stopped taking alcohol, or he or she has reduced taking alcohol, reduced the amount of alcohol. तो फिर क्या होगा? Patient will go into phase of alcohol withdrawal symptoms. Alcohol withdrawal symptoms. Patient will develop alcohol withdrawal symptoms. Now, alcohol withdrawal symptoms, there may be mild to moderate. There may be mild to moderate withdrawal. Okay. There may be severe withdrawal. There may be severe withdrawal. Remember, two important scale we use for ADS, means dependence, to see the dependence of this person to the substance. We severity assessment scale, we call it as SATQ, severity of alcohol dependence questionnaire. Severity of alcohol dependence questionnaire is used for alcohol dependence syndrome to see the patient is dependent. The level of the dependence is assessed by this scale. Okay, Now, for alcohol withdrawal symptoms, we have some scale that is called CIWAAR scale. This is the important scale for to assess the severity of the alcohol withdrawal. Now, if it is mild to moderate withdrawal and it is severe withdrawal, then the treatment will be different, because mild to moderate, even if you don't treat, the patient will survive, or patient will go into a phase of detoxification of himself and gradually will be out of this scenario. But usually is not like that. The patient will again take alcohol and he will continue the cycle. And for severe withdrawal cases, we need to admit the patient. Remember, we need to admit the patient. We need to admit the patient in the ward, mostly the DDC, drug de-addiction center, the most important center for this treating this patient. Okay, DDC, drug de-addiction center. Here we'll assess everything. Everything means now patient is severely dependent, and as well as patient is stopping alcohol. Now he has developed severe alcohol withdrawal symptoms. Now he will have so many problems. Why? Because number one, the patient will complain that his sleep is disturbed. So you have to take care of the sleep. Number two, he or she will have decreased appetite. Not appetite, actually food intake. Not appetite, actually, that is food intake is reduced. That is food intake is reduced. Once food intake is reduced, what will happen? There will be some electrolyte disbalance. So we have to look for the electrolyte disbalance. Okay, electrolyte disturbances we have to look for, and we need to keep some energy for this person. And we specially prefer is 10% fructose in water. 10% fructose in either in water or in saline. If the patient blood pressure, we look at the blood pressure, BP. If BP is lower side, then we will give saline. We will give 10% fructose in saline. But if BP is higher side, we will give 10% fructose in water. Okay, so this is the process of taking care of this person. Okay, taking care of this problem. And for the sleep, actually patient is alcohol withdrawal, so we need to give some important drugs which will act like alcohol and patient will be able to sleep. For that, we'll go for benzodiazepines. Benzodiazepines are the group of drugs that acts just like alcohol, and preferably we'll use one of the important or short or intermediate acting benzodiazepine, that is lorazepam. Lorazepam we'll use in the form of injectable, right? Patient is in serious condition, we'll go for injection lorazepam. We'll go for injection lorazepam, and we can titrate according to the condition of the patient, whether the tremor, tremor of this patient and other parameters. We can lorazepam, we can go twice daily, then we can go for thrice daily, we can go for 4 times daily. So it depends on the patient severity of the symptoms. Okay, number one. Number two, we have given the fructose. Number three important is vitamin B1. Vitamin B1. Vitamin B1 is the thiamine, very important. Usually we give 100 milligram injection. Most likely they comes in the form of 100 milligram. We give IM either OD or once daily or twice daily. Why? Because almost 100 to 300 milligram we should give. 100 to 300 milligram we should give in patient of alcohol withdrawal symptoms according to the severity of the symptoms. Okay, so you can give OD, BD. Most likely OD is preferred somewhere, BD is also given, and some injections comes in form of 150 milligram per ml, okay, per vial. So you need to decide on how much you have to give. So this is the important part, and we should look for the temperature, right? We should look for the temperature. We should look for the urine output. We should also examine two important part, that is in general examination we should look for the pallor. Pallor, most likely pallor will be there because patient is chronically regularly using alcohol. So there will be lack of food intake, as well as there may be liver damage, which also cause low hemoglobin. That condition is called pallor. We can see icterus, that is jaundice, in this patient. Usually we see jaundice in this patient. We can also see ascites. Ascites means collection of the fluid in abdominal cavity. किसी का देखिएगा पेट बहुत फूल जाता है, that is called ascites. Okay, so this we have to look for during the admission, and we should not forget to examine par abdomen. In par abdomen we can get some organomegaly, because the patient is using or abusing alcohol, so there is high chance that liver size will be increased. Okay, so these are the important, and correct the electrolyte. The patient may go into delirium tremens, where everything gets high up, like BP will be high, pulse rate will be high, respiratory rate will be high. These are the criteria. You have to maintain urine output, input and output, everything you have to maintain it. Okay, and if you strictly follow all these criteria and use accordingly, the patient comes out from delirium within 3 to 4 days, and gradually patient become very improved in his condition, and then we can allow him to go into a motivation enhancement therapy, what we call it as psychotherapy, or we can call it as a motivational therapy, where we allow or we discuss everything about the alcohol, why he should take alcohol, why he should not take alcohol, and every details we teach them and inform them. Then only we help them to quit the alcohol. So this is all about the alcohol withdrawal treatment. Now another condition is that patient in intoxicated state, patient will come into the department. Remember, this patient will be dealt by the medicine people, not by the psychiatry. Thank you so much.